the first time in the last 50 years in BC, a naturopathic practice has been modified a good way. The Ministry of Health and BC government have finally recognized the role of naturopathic physicians as a primary care physicians. They've enhanced the scope of our practice by allowing us to prescribe certain pharmaceuticals when needed. This is a breakthrough in a historical paradigm shift in naturopathic medicine, which will allow us to use our skills and our education to the fullest, and also give our patients choice for the health care. We as naturopathic doctors, we are fully trained to diagnose and treat and prescribe certain pharmaceuticals when needed. The scope of our practice, our education includes at least 3 years of pre-medical education or undergraduate degree, which includes certain pre-med requirements. After that is 4 years of postgraduate medical schooling, which requires more than 2,000 hours of practice. Our scope of practice is not a single modality. It is an array of different modalities that we use, such as homeopathy, physical medicine, nutrition, traditional Chinese medicine, acupuncture, counseling, pharmaceuticals, minor surgery, as well as some additional therapies which require additional training and additional board certifications, such as IV therapies, neural therapy, IV chelation, etc.
We try and focus really where the patient is focusing, because if you listen carefully, which is really the art of naturopathic medicine, is to listen to the whole person, then we're able to guide them what will be most efficient in their healing path. And the evaluation that we do to decide which course of action would be most appropriate really depends on what the patient needs to heal first. And that can be ascertained by a discussion. Where is the focus of the discomfort? Where is the pain? Or where is the dis-ease?
A lot of people feel that they can't come in to see a doctor until they are sick enough or they have a big enough problem. So this leads to the issue that people feel they cannot take care of their health until it's too late or until they have the big symptom. And a big thing about naturopathic medicine is that we're big about health promotion. So we want to help you prevent from having these problems. So in such a way, we look at your diet, we look at your overall lifestyle and even your exercise, and try to help direct you in a way that best suits you. So a lot of people say, why do I need to do this when I could go on the internet, for example, or ask other health professionals for help? And a lot of times that these sorts of information, such as magazines, internet, give the general advice without giving specific advice.
When a patient comes for a naturopathic visit, it usually takes an hour to hour and a half. During that time, you build a relationship with your doctor through an interview, and by getting your doctor to know you better and finding out what the cause of your problem may be. During that time also, the doctor will educate you on how to change your lifestyle positively and maintain your health state, as well as develop the plan, the short-term and long-term goal together with you. Then after that, the patient will have to do some follow-ups with the doctor, and that will depend on the severity of their disease. Follow-up treatments are usually shorter, from 15 minutes to half an hour and sometimes to 1 hour, depending what modalities we use for treatment.